Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. As the last video covered uterine fibroids in women, today let's take care of our men while exploring the topic of prostate enlargement and how to heal this ailment with natural and effective therapeutic tools. It's perfectly normal for a man's prostate to grow during his adult life. Some men experience no symptoms at all, but for others an enlarged prostate may lead to issues that not only affects the prostate health, but also the quality of life. So enjoy this video. To stay updated with more ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell as it notifies you every time I upload a new video. If you are interested in learning more about homeopathy, mental health, health coaching, quantum healing and so much more, have a look at my website medicanova.net at the online academy, where you will find certified comprehensive home study online courses. And if you're interested in a health consultation, either for yourself or your children, contact me at health@medicanova.net. So what is an enlarged prostate? An enlarged prostate affects 1 in 5 men between the age 50 to 60, and it's even more common in older men. Now, the prostate is a gland of the male reproductive system, and it's located just below the bladder, between the rectum and the base of the penis. Because the prostate sort of wraps around part of the urethra where the urine passes through, an enlarged prostate is often associated with urinary symptoms. Now, the prostate gland is a gland about the size of the walnut, and its job is to secrete prostatic fluid. Prostatic fluid is a component of the semen, and it forms around 30% of the total semen. The prostate gland muscles also aid the expulsion of the semen during ejaculation. The approximate weight of the prostate gland ranges between 18 to 15 grams. And the normal size of the adult prostate gland is about 15 cc to 30 cc. It means like 1/2 ounce to 1 ounce. Now, prostate gland of more than 30 cc usually indicates there's a benign prostate hyperplasia. And benign prostate hyperplasia, or BPH for short, refers to a non-cancerous enlargement of the prostate gland, and it's also termed as benign enlargement of the prostate. But when the prostate grows, it may push therefore against the bladder and the urethra, and making you feel like you need to urinate even though the bladder is maybe not very full, or preventing even the urine from flowing out naturally. Now, this feeling becomes even stronger when the muscles at the bottom of the bladder begin contracting, even when only there's a small amount of urine present. Now, over time, this constant pressure can weaken even the bladder muscles, and as a result, the bladder will no longer be able to empty itself properly, always leaving some urine behind. So you see, it's sort of a catch-22. It starts with an enlargement of the prostate affecting the bladder, and eventually the bladder gets weak, affecting the prostate. They go hand in hand. So what are the symptoms? Frequent urination, especially at night, big time here. Difficulty postponing the urination, so you feel like, oh my God, I can't hold it anymore. It takes much longer for the urine to start flowing. Straining when urinating. The urine flow may be quite weak, or it takes a long time to finish urinating. There may be dripping or leaking after urination, or this feeling like the bladder is not empty after urinating. So you see, every case is unique, and every patient requires a targeted individual treatment protocol. And in this video, I will share with you remedies for specific symptoms, so you really have much more the chance to heal this situation. But there's not always a direct relationship between the size of the prostate and the symptoms. So men with very large prostates, they may not experience symptoms at all, while others who don't have a very large enlarged prostate may have a lot of problems. So about a third of men with an enlarged prostate have lower urinary tract symptoms that can interfere with their quality of life. And the symptoms of the lower urinary tract symptoms include, as I mentioned before, filling symptoms, frequent urination, especially at night, or voiding symptoms. Maybe there's a poor stream, incomplete urination, and this tripling after urination. Now, occasionally men with enlarged prostate may also suddenly have difficulty urinating, or they cannot urinate at all. This is a different situation, and it's called acute urinary retention. It means the urine doesn't come out, and it really requires medical attention immediately, so you have to go to emergency. It commonly occurs in men with an underlying benign prostate hyperplasia. Maybe there may be precipitating events like getting cold or excessive alcohol consumption, or maybe a side effect of medication. Now, there's often a confusion between prostatitis and benign prostate hyperplasia. They're not the same. Whenever you see a name and it ends in itis, it means it's an inflammatory condition. On the other hand, this benign prostate hyperplasia, it means it's just an enlargement of the prostate gland, and which is mainly age-related. So what are the causes? Well, as already mentioned, it's perfectly normal for the prostate to grow during puberty. And until it's about the size of the walnut, around the age of 25, the prostate begins to very slowly grow again. And prostate growth is not the same for every man. For some, it grows a lot more than in others. We also have hormonal changes happening here. And the changes occur with the male sex hormones as part of the aging process. And they appear to play a role in the enlargement of the prostate. We have a hormone called testosterone. It affects the prostate growth. So the prostate converts testosterone into what's called dihydrotestosterone, or DHT. And DHT stimulates cell growth in the tissue that lines the prostate gland. Now, this is the major cause of an enlarged prostate gland, and it commonly occurs between puberty and young adulthood. We also have the hormone estrogen. It plays a part here as well. And as men age and testosterone levels drop, the proportion of estrogen increases and may therefore trigger prostate growth. So age is a major factor here for enlarged prostate, and according to an overview on benign prostatic hyperplasia published in Reviews in Urology, the actual enlargement of the prostate gland develops as strictly age-related phenomenon in nearly all men, starting at approximately 40 years of age. There also was a correlation between this benign prostate hyperplasia and lower urinary tract symptoms with cardiovascular diseases. And the underlying reasons and the correlation, they don't have an idea what's going on, but researchers speculate that by causing sleep disturbances, blood pressure variability, and increased cortisol levels, an enlarged prostate may be a risk factor also for cardiovascular disease. So what's the conventional treatment for an enlarged prostate? It really depends on the severity of the symptoms and the risk of complications, such as urinary retention. But most of the time, men have no treatments at all at this stage. It's just about sort of watch it and see what happens before any medication is provided. So this video is really important at this stage, because I want to give you really effective treatment protocols which we can use and apply, so it doesn't have to go into the phases where you are then dependent on medication or even think about surgery. Usually the medications would be alpha blockers. They are used to relieve the benign prostate hyperplasia symptoms within a few weeks, but they don't actually stop the prostate gland to grow. Maybe there's another medication called 5-alpha rectidase inhibitors, and they're used to reduce in enlarged prostate, but they take about 6 months to show any effects, or they maybe put these drugs in a combination together as well. Surgical procedures, yes, they're used to remove or destroy the prostate tissue. But as I said, it only comes to mind when they have severe complications or the symptoms of an enlarged prostate have become so strong that it really affects the quality of your life. But before we go into the natural treatments, today, I know it's a longer video today, I want to give you some food for thought, because there's a story behind the prostate enlargement. It's called metaphysical meaning, and I want to just give you some different approaches how to deal with prostate enlargement. Always refer to Jacques Martel's book, and he said the prostate is related to my feeling of social power and sexual capacity. As prostatic disorders are more prevalent among older men, I must ask myself, do I feel satisfied and comfortable with my sexuality? Am I experiencing frustration, impotence, or maybe even confusion about my sexuality, and also about my search for a possible younger partner? Should I best give it all up now? I may now be feeling useless, ineffective, and incapable of being a real man. You see, has a lot to do with sexual power. I may also feel that I'm not up to my children's needs or simply a poor father. Am I still desirable? I live in intense fear of not being within the sexual norms that society has established, especially if I or one of my children are homosexual. Am I comfortable with my sexual desires or the size of my genital organs? I must learn to rid myself of guilt and stop putting pressure on myself about the performance that society wants me to achieve. I must become aware of my worth, not only for my sexual exploits, but by looking at all the good human qualities that I possess. I might have the impression that I'm badly muted with my spouse, that we form a mismatched couple, especially in the sexual area. Do I repress my emotions and my creative impulses? I may experience a platonic love that is not expressed in my physical body. If I don't know my needs and desires, it is as though I were disconnected from my own person. I feel forced to prostrate myself in front of someone or even before God in whom I believe. That is humiliating, or can be for some. I stop pressurizing myself over things to be done or things I no longer have to do. Am I feeling vulnerable over money because I'm going into retirement? Do I feel useless, being now much less in the midst of action than when I was on the active labor market? If I have difficulty in the prostate, I must ask myself if I may experience difficulty and guilt in front of my grandchildren or my own children, who, although they have grown up now into adults, are still for me little and fragile. I fear they are in moral and physical danger, maybe, especially in any situation related to sexuality and that appears in my view as dirty or outside of the customary norms established by society. I still want to be the protector. I tend to want to adjust myself to the expectations of others. I also want others to conform to my values or to those of society. I have the impression that I have enormous anomalies and I don't know quite what to do and to be within the norms. I often feel that I'm strange, different from others, and I don't like the image as a father. With prostatitis, the inflammation of the prostate, I may feel disappointment or frustration, either with what my partner expects from my sexual exploits or with myself, or I resent myself for not more highly performing. I find myself old, worthless, finished, and I can't possess my partner. So what's the positive affirmation here? It won't be, I accept to learn to enjoy life, not only sexually, but also with all my senses. I can be in contact with my creativity and achieve great things. I also accept to truly feel all the emotions inside of me and learn how to fully embrace them. They are part of me, and I thus regain full power over my life. So do you see last week we did the sort of uterine fibroids in women, and here again we saw the topic of overprotection, not being able to let go of your children, even if they're adults now, right? Because you feel like, oh my gosh, I have to protect them, they may be in danger. Same thing here a little bit. More it's related to sexuality, but very much this overprotective theme. In men, prostate problems is a real issue. It causes a lot of guilt and shame, right? So please just be vulnerable here, explore a little bit what's going on with you. Reach out to a homeopath who not only will be able to take care of the physical symptoms, but also will try to heal the mental and emotional, trauma here, which really ends up in a trauma. So what are the natural treatments for an enlarged prostate? Well, we want to bring down the inflammatory part, any toxicity within the body. So limit and avoid the alcohol consumption, caffeine. Limit drinking fluids more in the evening. Try to urinate every 3 hours, so it really makes sure that your bladder empties well. Engage in physical activity, right? Drop down your weight because it adds pressure to the bladder, and always increase sort of healthy omega fats in your diet as well as with supplementation. You also want to maybe engage in pelvic floor training. We call them Kegel exercises. Women are very well versed with that because of the bladder discomforts, but it strengthens the muscles in the pelvic diaphragm, improving involuntary or abnormal urine loss for men with enlarged prostate. What are the herbal supplements? Well, the first one is saw palmetto. Has been widely used as a therapeutic remedy for urinary dysfunction due to benign prostate hyperplasia. You also want to bring in stinging nettle root. It's wonderful. A study actually conducted in Japan found that stinging nettle has hydrophobic constituents such as steroids even that may inhibit the membrane tissue activity of the prostate, which may subsequently suppress prostate cell metabolism and growth. The most favorite here is pumpkin seed oil. And it's really found that pumpkin seed oil was able to reduce symptoms of an enlarged prostate within 3 months already, and maximal urinary flow rate was gradually improved significantly after 6 months. In my practice, Medica Nova, I use 2 products. They're called MPR Prostata, and it's also for the ovaries. Again, it contains saw palmetto as well as MPC. It's a prostatic corrector. It contains more Amazonian herbs like podarco, saw palmetto, as well as RNA and DNA prostate tissue. So there are many products out there which can really support these initial stages. I wouldn't like to finish this video without mentioning effective homeopathic remedies which can potentially save a person from surgical intervention. The homeopathic remedies I will share with you today, you are able to purchase at your local health food store or online. I would choose the Potency 30, which is an over-the-counter strength of a remedy. And, contact your homeopath here for a targeted personal individual treatment plan, or contact my practice Medica Nova at health@medicanova.net to book your appointment. So the first homeopathic remedy, it's not the herbal remedy, although it's the same source. It's called Sabal cerulata, which is Salmeto, but in the homeopathic form. And it's a top grade remedy for benign prostate hyperplasia. And here it's sort of a remedy which covers all the symptoms. Right? It's like the dribbling and the urination at night and the pain and all of that. So the first among them is this difficulty in pain once you start urinating. The person also experiences a frequent desire to pass urine at night, or as I said, there may be this dribbling urine is another problem. Aching pain in the prostate that extends to the abdomen is another symptom here. There's also retention of urine, like, nothing comes out. That means retention of urine from the prostate enlargement can also be treated well with this remedy. And it's also the treatment for emission of prostatic fluid during stool or urination. And last but not least, Sabal cerulata effectively treats the complaint of erectile dysfunction from an enlarged prostate. So it covers a wide range of symptoms. So the first remedy in my book is Sabal cerulata. Now, if you have just an interrupted urine flow, right? Not the other symptom, but this is really the top of the problem here, then conium maculatum is another extremely effective remedy for benign prostate hyperplasia. Again, here the key symptom is interrupted urine flow from enlarged prostate. So here the urine starts and stops several times before complete voiding. It's very unique to this remedy. After passing urine, there may be burning pain felt in the urethra. Now, if you have just burning pain while passing urine, right? It hurts. That's the main thing here. There are two remedies, Cantharis vesicatoria or Sarsaparilla officinalis. And the specific keynote here is burning pain while urinating. With Cantharis, you maybe have pain before, during, or after passing urine. And there's also this constant desire to pass urine in such cases. There's also maybe a scalding sensation. It's quite extreme here when passing of urine in drops. It's the main remedy for urinary infections also in women. Now, Sarsaparilla officinalis is taken when you have severe burning pain at the end of the urination, on conclusion of urinating, right? So it's why you have to really look at your specific symptoms. Now, if you have just frequent urination at night, no other symptoms, but you have to pee all the time, think about Lycopodium clavatum. It's also a great liver remedy. And here it's beside the frequent urination at night due to enlarged prostate. There's this need to wait to start urinating, right? You have to stand there literally for a few minutes before it comes out. In short, a person who needs this remedy, Lycopodium clavatum, passes not a lot of urine or insufficient, we say scanty urine during the daytime, and suffers more profuse urination at night. Now, we talk about the dribbling urine, right? Totally different symptom. And here we have dribbling after urination in benign prostate hyperplasia. The remedy would be Baryta carbonica. And it's also indicated if you have this sudden urge to urinate with the inability to retain the urine. The urine may be, again, scanty or insufficient. There can be burning while passing, but it's mainly the dribbling here which really, really starts to become a problem. So let's look at another remedy. When there is difficulty in initiating the urine, only, if that's the keynote, we have two remedies called clematis erecta and Gymophilia umbellata. In clematis erecta, you find this difficulty in starting to urinate due to prostate enlargement. And here you need to strain hard before the urine starts to flow. There's intense burning which may arise while passing the last drops of urine. There may be dribbling involved as well. Whereas in Gymophilia umbellata, the person needs to strain hard to start passing urine. The urine may be insufficient as well, but maybe a little bit offensive. There may be burning, scalding while passing the urine, or even, the body needs to have to be pushed forward so you can urinate. So both are indicated for this symptom like difficulty when initiating urine, but I think with Gymophilia umbellata is just a degree more intense, right? You have to push your body forward so you can urinate. Again, if there's just the urgency to urinate in general, Thuja occidentalis would be a good remedy here as well. Frequent urge to pass urine, burning or cutting pain while urinating. But often I feel like it treats involuntary urination at night, right? Where you can't hold it. Usually you pee in bed. That's what it means. Now, the last remedy I would like to share with you. Remember we talked about sexual complaints caused by prostate enlargement. As a remedy, the homeopathic form called Agnus castus. And it's very well indicated for treating sexual complaints in men from benign prostate hyperplasia. So it treats this sort of loss of sex drive in men who suffer from BPH. And, I think by then it becomes a real emotional traumatic situation as well. So Agnus castus would be very helpful here. So I hope this video, again packed with a lot of information, inspired you to seek out holistic and natural treatments about healing your prostate enlargement. This can be done, particularly in the early stages, and don't drag it out for too long and say, oh, well, I'm just getting old and nothing can be done. No. You have so many possibilities here to really, help the health of your prostate again. To stay updated again with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell as it notifies you every time I upload a new video. So till next time, much love, take care.